I actually sought out using the BioZorb a few years ago after a patient of mine had inadvertently had a boost radiation dose to the wrong site in her breast. In collaborating a little more closely with my radiation oncologists, what we didn't take into account was the fact that when we were all trained as breast surgeons, for the most part we were making our incisions as close to the tumors as possible. And therefore, it made it very easy for the radiation oncologist to know where to boost the patients. They would just go to the scar. Thankfully, we've gotten a lot better. And nowadays, with oncoplastic surgery, it's our goal to hide the scar as best as possible. Without the BioZorb, it's anyone's guess where the radiation oncologist should give a boost dose. And we can make approximations with clips, but if you go down and look at a CT simulation with a radiation oncologist, and I encourage all my surgical colleagues to do so, you'll recognize just how ineffective clips are as a means for the radiation oncologist to know precisely where to give the radiation. And what do they do without the clips or without the BioZorb? They're just going to give a very large dose to make up for the uncertainty of where the cancer was. So my main goal in using the BioZorb was to assist my radiation oncologist to know precisely what to treat and where to treat, and therefore limit the dose of what we don't want to treat, namely the chest wall, the lungs, the heart. What's been so rewarding using BioZorb is that now, after a few years of experience and following up with patients, you can really tell a difference. And there is an obvious cosmetic benefit beyond the benefit of the precision of knowing exactly where to give the radiation therapy.